Welcome back to Insight. We're at Goshen Center for Cancer Care with Dr. Von Holzen, and I want to talk about minimally invasive surgery, which, explain again for folks what that is.
Minimal invasive surgery is a way to conduct operations with very small incisions. So instead of doing the big incisions like we used to do traditionally, we would do small, very small incisions, maybe half an inch or so, and get some specialized instruments in the camera in there to actually see and have the magnification effect and see what we're doing in there. So it's just a way to get there. On the inside, usually the operation is the same, but we don't need the big incisions to get the operation done.
And so I'm assuming recovery time traditionally would be quicker.
Traditionally, recovery time is quicker. There's additional benefits. Obviously, small incision means smaller scars. Usually means less pain, because you don't have that big cut that hurts for a while. It heals faster, usually less infectious complications or wound infections. And obviously, like you said, usually faster time to recovery.
Now, why isn't minimally invasive surgery just surgery? Why are all of them like this?
I mean, it's kind of like a more demanding kind of surgery. Obviously, it needs special training, it needs special equipment. You need special know-how to be able to perform these operations. Usually it involves fairly long and extensive training to do these operations well. You're kind of a little bit away, so if it starts bleeding, you can't just put your finger on there like you have it in the open, so you need to have some more technical skills to be able to perform these operations.
So it's more of the physician and the facility that drives minimally invasive, not necessarily the diagnosis.
I think it's both. Depending on your tumor and the extent of the operation that you need, sometimes a minimal invasive approach is just not feasible. If you have a huge tumor that you need to take out, you need to make a big incision anyhow just to get it out, so why bother with the small incisions and try to get it out. Having said that, as technology evolves, we're getting better and better in even tackling more extensive and bigger procedures, bigger operations, bigger tumors.
So is there one sort of surgery or one sort of area of the body that tends to lend itself best to minimally invasive surgery?
I think we have pretty much every part of the body can be assessed by minimal invasive surgery approaches. We can go into the chest, we can go into the belly, all kinds of different operations that we're doing, and it's clearly the trend to go there. Patients want to go home as fast as possible, obviously. And minimal invasive surgery helps achieve that.
So recovery time, can you give me an examples in minimally invasive surgery?
Again, it depends on the kind of procedure
Sure.
you're doing, right? I mean, we have procedures where patients go home the same day or go home the next day, whereas if you have a more extensive cancer operation, they might still be here for a week or 10 days. The time in the hospital is the one side, the time to kind of recovery at home is the other side, and then usually patients that have these small incisions, they're up and about much faster, they can do the stuff that they can do at home. So the total recovery time is usually much faster, not necessarily the time in the hospital only.
Patients come from pretty far away here to Goshen, don't they?
Yes, they come from the whole region here. I mean, we have a very unique settlement or placement here. We have all these specialists, we have all the techniques, we have all the special training necessary. They're probably the most advanced minimal invasive, at least cancer surgery center in the region, and patients travel quite a distance to get here to get their operations done here.
If you'd like to find out more about Goshen Center for Cancer Care, you can look them up online at goshenhealth.com. We'll be right back on Insight.